Hello, everyone. Welcome to Clinical Dimensions with Dr. O. I am Dr. O. I am a university professor, but I'm also a clinician who work in the field with people who have a variety of disorders. These disorders can fall within the classifications of mental disorders or substance use disorders. In this particular segment of Clinical Depressions with Dr. O, I will focus my attention on teaching you the criteria for diagnosing a major depressive disorder. Major depressive disorder is the clinical title that you will find within the DSM-5 of what the layperson described as depression. But as a clinician, we describe the disorder as major depressive disorder. Or you may just hear some clinicians say, this person have a clinical depression. What I want you to understand is a major depressive disorder is not sadness every now and then. There are diagnostic criteria that we must meet in order to say, as a clinician, that someone has a major depressive disorder. Basically, we understand as clinicians that people get sad every now and then, from time to time. This sadness is normal. Basically, for example, if someone just lose a job, you can expect that that person is going to be sad. So, the criteria for a major depressive disorder is so much more vast. The criteria tells us that we can diagnose a person with this particular disorder. So we will go into the criteria within a few minutes. So, a general overview of this major depressive disorder is that there is persistent, ongoing feelings of sadness and hopelessness within this individual. The person may lose interest in activities that they once enjoyed. Physical symptoms may also appear, like they may say, I have a headache, or chronic pain, or digestive type issues. And these symptoms must be present for 2 straight weeks. For 2 straight weeks. So let's go into the diagnostic criteria that's within the DSM-5. And I'll show you the DSM-5 at the end of this presentation, just so that you can know what this particular book looked like. It's almost as if it's our diagnostic Bible, so to speak. This is how we arrive at the conclusion that a particular individual have some type of disorder. So once again, we're going to focus our attention on depression and its diagnostic criteria from the DSM-5. So as we focus on this diagnostic criteria, we must understand that the individual must experience 5 or more symptoms of depression within a 2-week period. 5 symptoms or more within a 2-week period. So one of these symptoms must be that they have a depressed mood or a loss of interest or pleasure in the things that they once enjoyed. So for example, if this person enjoyed going out to bowl every week at the bowling alley, and suddenly within this 2-week period that he or she just stop. And this person can really enjoy bowling, that they go every day to the bowling alley, and then all of a sudden they stop. Then it could be that we can consider this factor. So another thing that we must consider is that the depressed mood is most of the day, nearly every day within this 2-week period. There is diminished interest or pleasure in all or almost all of the activities that they once enjoyed. Most of the day, nearly every day within this 2-week period. There must be significant loss in weight that is not caused by dieting or weight gain, or a decrease in appetite. So they're just not eating, or they're eating too much. Another criterion that you can consider is that this person is slowing down. So there's a slowing down of thought and a reduction in physical movement. So this person is feeling restlessness or just slowed down, no energy. They're feeling fatigue nearly every day. Another criterion that you can consider is this feeling of worthlessness or guilt that they experience all day, nearly every day. Here are other criterion that can be considered by the clinician in diagnosing a major depressive disorder. This individual may have an inability to concentrate or to make decisions nearly every day. There could be thoughts of death, such as in, I am going to kill myself, or even, I am going to kill someone else. This is the criteria that we particularly pay attention to, because we don't want someone to bring harm to themselves or to bring harm to someone else because they are depressed. A lot of times when we see situations of an individual going into a school and shooting the school, the kids in the school, or going into a synagogue to shoot the members of a church, they've been depressed and probably depressed for a period of time. And this is the feeling that they have, that I am hopeless and I just don't have anything else to do, or I'm so angry, I don't have anything else to do but to go and bring harm to someone else. That is not what we want to see happen. We want to recognize these symptoms of depression so that we can get this individual help. And especially also if they're trying to harm themselves. Now, these symptoms, all of the symptoms that I just detailed, to you must bring about this distress and impairment in social, occupational, and other important areas of functioning. So this person just cannot function the way that they were functioning before the depression became a part of who they are. And so basically, as a clinician, we look to see if this person is experiencing at least 5 or more of the criteria that I just illustrated and spoke to you about. And then we can, if the criteria is met, diagnose this person with depression. Now, there's something that I like to say as far as basically when a person have just lost a loved one, we can expect that this individual is going to feel grief, not depression, but grief for up to 6 months. Now, basically, what I want you to understand is if this person have been experiencing grief for 6 months or more, then we can move the person from bereavement classification to a major depressive disorder after the 6-month period of experiencing this grief. Because as clinicians, we expect that this individual is going to experience grief for this period of time. Now, finally, other features that we must pay attention to when we diagnose someone with a major depressive disorder is we must consider if there are manic symptoms present, meaning is this person extremely hyper, talking very fast, a lot of irritability, and other diagnostic criteria that I'll talk to you about in the future when we consider manic symptoms. Now, you may ask the question of how can we tell if this is actually a bipolar disorder? The criteria for a bipolar disorder has not been met. So basically, the whole idea is that the person is just experiencing some symptoms, but not a full-fledged bipolar disorder. Now, another thing that you can consider is whether or not this individual has some anxiety type symptoms or just is in a state of distress. And so when you write your reports or diagnose this individual, you can say the other features are with manic symptoms, anxious symptoms, or distress. Hopefully, I've been of help to you in understanding the criteria as denoted in the DSM-5, and I promise to show you this particular manual, and I'll do this now. This is the DSM-5. This is our Bible for diagnosing an individual with either a substance use disorder, or a mental disorder, or any other type of clinical disorder. So basically, I'll meet with you again because I plan to do more segments of Clinical Dimensions with Dr. O. Stay blessed.